supposed to do for me. When I got out as a single person, not being married, it was just, okay, I'm just making this ton of money. Now it was more of, I use money as a tool to get me where I want to go, which was being financially independent and not so dependent on that income to kind of lead the lifestyle that I want to live. So it's kind of all those combination of factors that led me into the whole thing. And oddly enough, what was happening is I saw so many of my colleagues that were miserable, that they're doing all these shifts and they're not getting anywhere. A lot of physicians are very frustrated right now about all the stuff that's happening, that they're losing autonomy. And for me, this was a way to say, hey, look, I felt the exact same way, but there is something you can do about it, which is to transform your relationship with how you view money and what it's all about.
So you were in clinical practice. You'd kind of fooled around and found out that you weren't great at it, that you'd made a lot of mistakes. How did you go from being a novice to somebody who is now running a business in which you're touting your expertise in this area?
Yeah, that's a good question. The first thing I had to figure out was, how do I get from working a full-time emergency medicine shifts per month to doing full-time financial planning? How do I get from point A to point B? I mean, I didn't know where to begin because I thought that, all I had to do was go to Merrill Lynch and Smith Barney and all these places that, everybody knows about and get some sort of training there and just become a financial advisor. And I think what happened, from what I recall, from 6 years ago or so when I started this whole process, is I came across a group which was called the National Association of Personal Financial Advisors. NAPFA is kind of the short term for it. Most people have never heard of NAPFA, and there's a good reason for it. But this was an association that basically said, there's something wrong in the financial services industry, which is that advisors are paid by commissions. Why should it be like that? Why can't the client pay the advisor a fee directly? And that, to me, resonated with me huge, because I was seeing all these physicians that had advisors that were commission-based and had inherent conflicts of interest. I said, I need to contact people in this group. How do I do that? So it turns out that NAPFA all across the U.S. and usually the major cities have these study groups. And so I called up the leader of the study group here in Atlanta, and I said, hey, I'm a physician. I'm interested in financial planning. I really don't know how to make this transition from what I'm doing now to what I want to be doing. And so I started going to the study group meetings, meeting a ton of independent advisors, what are called fee-only advisors. And I started interviewing a bunch of them and saying, hey, what would you suggest for me to do to get from point A to point B?
So your goal really was to move from clinical practice to be full-time financial advisor for physicians?
Not when I got out of residency, but as my passion grew for all this stuff and all the things that happened to me in my personal life and seeing other physicians, then I made the decision, this is what I would do, because I love it so much. It's kind of like, there's a saying, I think it's, I can't remember who said this, I think it's some sort of Chinese proverb or something where it said, if you choose a job you love, you'll never have to work a day in your life. And that's kind of the way I look at financial planning and wealth management is I love it so much that I don't feel like I'm working. And that's the best career to have is when you feel like you're not working, but it's a career, that's where I want to go.
So do you think you chose the wrong major in going to medical school?
Well, I think there's a couple things. I mean, the actual science of medicine, I think, is still fascinating. And if it were just, okay, I see the patient, I take care of the patient, and, everybody else leaves me alone, then, fine. But turns out that, whether you work in the ER or other professions, you don't actually practice medicine that much on a daily basis. Most of it ends up being administrative, stuff that, I didn't sign up for, stuff that I don't even think should be in my job description. And it turns out a lot of the things that we as physicians do now really should be the job of somebody else. So it's kind of a loss of autonomy is the way I kind of look at it. The other thing with emergency medicine in particular was that I felt like we had accountability and responsibility without authority, meaning we were blamed for things that were beyond our control, but we couldn't change anything because we had no authority to do so. And so to me, that wasn't the right way to treat physicians. And it wasn't really a matter of arrogance or any sort of, I'm better than somebody else. It's more of, okay, if I'm the one seeing the patient, then I should be the decision maker, not somebody else. And when you take that aspect away, the whole physician-patient relationship just breaks down. You can't have something where the physician seeing the patient and somebody else who's a non-MD is telling me what I should be doing, and then me not having the authority to change anything.
Do you think that's a characteristic of emergency medicine that does not extend into kind of private practice or private clinics?
Well, I know that it's absolutely true in emergency medicine, but it's spilling over a lot into other other specialties as well. So one example of that would be, a big trend that's happening now for example, cardiology, internal medicine, and so on, is that it used to be even 10 years ago that you'd have these small physician practices, and now what they're doing is all these hospital practices are buying out all these independent practices. And so it used to be, you drive down the highway and you'd see kind of, just these regular billboards. And now what you're seeing is these billboards that are advertising physicians groups. And they'll have stick this, face of this doctor on there. Wouldn't even put his name. It'll just be, such and such hospital physicians group. So I can't imagine a scenario where the physicians in those groups would have a huge amount of authority. Because
well, let me ask you this, because you bring up a very interesting point. Is that the most efficient way to deliver healthcare? Is it more efficient to have consolidation as opposed to kind of a myriad of independent physicians? Is the delivery of medical services made more efficient by that kind of a model?
Yeah, that's a good question. I'm not sure what the answer to that particular question is, since I wouldn't have anything to back up any sort of data with evidence. But from kind of my perspective is, let's say it is more efficient. I think kind of the bottom line is that it ends up becoming less personal than what it used to be when had these smaller practices. And I think a lot of the patients are even saying so. I mean, like I work in urgent care now, as well as, and I used to, of course, work in the ER, and a lot of patients would come in and ended up primary care doctors, but it's become a lot less personal, which is really not what medicine should be, at least from a patient-doctor perspective. So I don't know exactly what the answer to that question is, whether it's more efficient or not. Plus, it depends on how you define efficiency, whether it's number of patients per hour, or is it, reduced costs, or what it is. But to me, the disturbing trend is the loss of autonomy that physicians have experienced, not just in emergency medicine, but what I'm seeing for other specialties as well.
Which is why we had, Medical Supply MD there's so many physicians now that we're not thinking of cosmetic practice when they went through medical school. They were family practice or ER docs or internists, and have now moved or migrated towards cosmetic medicine as a way really to kind of gain control of just that kind of autonomy, to get rid of, third-party reimbursement and all the insurance and those types of things, and kind of gain a tremendous amount more control over both their finances as well as their kind of lifestyle, and be able to set that themselves. So you made a kind of a transition, but you're still practicing clinical medicine. Is that because you have the need to do so, or you still just kind of desire that, and you feel that you're really balancing these two kind of career paths and are able to do that?
Yeah, I think there's two reasons. One is, you go through all that training, it's almost like an insurance policy. Let's say something happens and this financial planning business fails. Well, as a financial planner myself, I better have a plan or a backup plan for myself, just like I advise the clients for their personal finances. So that's one issue. The other issue is that since my niche market is specifically mid-career physicians, I think it would be a mistake for me not to work a couple of shifts a month to know what the challenges and the trends are in medicine itself. So if I completely just stopped and did financial planning, 30 days a month, then the concern I have is that if I want physicians, or specifically mid-career physicians as clients, it's much easier for me to relate to them if I still am in that profession and know what the challenges are, know what the trends are, know what the frustrations are myself, and that way I can convey that to clients saying, hey, look, I'm one of you. I know what you're going through because I see it, I still practice, and I can relate to it.
You decided to target mid-career physicians for what reason? Is that because that's where kind of the belly of the market is? Is there, is that a business decision on your part, or was it because you feel you're in that kind of group, and it's this kind of relationship that you have?
Yeah, I think really it was, to specifically answer that question is, it's kind of maybe even a little bit more narrow than that, which is first I started with this concept of, okay, I'm going to have physician clients, and that's my market, but it was still too big. So then I said, well, who are the people that I really relate to? And of course, the people that I relate to are people who are like me, which is mid-career physicians. Now, the people who are out of residency training, I could argue very well that perhaps they need more financial advice, and maybe they have more need for an advisor than maybe anybody else, because if you can prevent huge mistakes that early on, you'll be much better off. The only downside to people who are just out of residency training is they're in a huge amount of debt. A lot of them don't see the need for an advisor, and frankly, a lot of them just don't want to pay a fee to anybody. But the people who are kind of mid-career, the ones who started families, who are several years out of training, generally 5 to 7 years or more out of training, who now have all these complex issues, what happens if I die? What happens to my kids? Am I saving enough? I got college things looming. Now they got estate planning issues. And these are the exact same issues that I faced personally for my family. And so for me, you're right. Mid-career physicians is part of the group that I'm part of, and so for me it's just easy to relate to them. The people who are pre-retirees or nearing retirement, certainly I don't necessarily exclude them, but I can't relate to them as well as I can the people who are kind of basically mirror me and the challenges that I face currently.
You mentioned, avoiding the mistakes just after you graduate. What are the mistakes that physicians commonly make?
Yeah, that's a good question. That's one of the things I'm going to talk about in the conference. But to kind of give you an overview, if I had to choose a couple of huge mistakes that physicians make in their personal financial planning, the first one is that they don't have a plan. And what I find kind of ironic about all that is, when we apply to medical school and college and residency, we kind of sort out all these, here's where I want to go, here's the pluses and minuses of this program or that program, and then we start looking for jobs, here's the pluses and minuses of, going here or going there, but when we get out, now all of a sudden we don't have a plan at all for our personal finances. And by a plan, a lot of people just say, well, okay, I got out and I'm just going to pick a couple stocks and do this, that, and the other, but none of that is really integrated. And so, to me, the biggest mistake is that people don't have a comprehensive financial plan for themselves that integrates not just investments, but, protecting their wealth, growing it, and, of course, ultimately transferring it when they die. Those issues need to come up pretty much as soon as you get out of training, and that's, I haven't really found that many physicians that have done that. That's one big mistake, is not having a game plan. But the other two are, or other couple that I see are, second is overconfidence. And this kind of gets back to my personal experience, which is I thought, gosh, I can do this myself because I went through all this training, so, surely doing all this financial planning stuff is easy. It's kind of like there's all these surveys done saying, well, gosh, 80% of drivers think that they're above average drivers. Well, that's mathematically impossible. And if you look at a lot of physicians, they suffer from this overconfidence syndrome, which is that, hey, I can do this myself. And they get into all these speculative investments, all these things that they probably don't need, and a lot of them end up getting burned. One of the huge other things, like I mentioned before, is choosing the wrong advisor, which one of the wrong advisors, it turns out, is yourself. which is, a lot of people try to do it themselves and make huge mistakes. On the other hand, it's kind of a catch-22 because if they hire somebody, then